We are still struggling with the case. Can we show them the live follow images? So you see now we decide to put in another plug. So because the first time while we create the AV loop, there's a significant drop in blood pressure. So we dare not to do it again. And so this time the strategy is to put a stiff wire in the LV, and then we go with the delivery system. But the problem is, probably you can show the previous angel. Go back. Go back, go back, go back. All right, go back. All right, we tried very hard with this wire, stiff wire, we tried to track the 9 French delivery sheath across the defect, but only the dilator can pass through. Next. So another strategy is that we better position the stiff wire, form a better loop in the LV. Next. So dilator pass through, we pre-dilate the tract. Next. And then we still fail, so we use a peripheral balloon. This is a 5 millimeter balloon, 2 centimeter long. So we pre-dilated it, and now we try to go for the 9 French delivery sheath again.
Actually, it's an 8 French, I think.
Oh, sorry, this is 8 French. So now it's live, so you see we do struggle a bit. All right, let's see whether we can go.
You need to understand it's very difficult to cross because we need to cross the septum first, which is very fibrotic in this case because of the 3 surgery that she had. And then we need to go across the leak just after and just beside the other device also. So there's a lot of different challenge in this case. We try to go.
Yeah, so it seems that we still need a bit of time to work on. So maybe, you keep on going the lecture first. Horst is preparing a case of airway occlusion. So maybe you can, after a couple of lectures, then we can go back for live. How about that, gentlemen?
All right. Okay, so we'll get back to you later. So
okay, thank you. Okay, maybe Rita can educate the audience what happened.
So remember that we put the first device and then we put. It was difficult to go back over the wire, the safety wire that we let in place with the delivery sheet. So we were planning to go with a second AVP3. But because we were not able to deliver 8 French sheet that was required, we decided to switch for an AVP2, knowing that with an AVP2 you can use a smaller delivery sheet. In this case, it's a 6 French delivery sheet. So let's go back. Maybe let's go back on fluoro. What we record so far, just to show what we.
Fluoro? Yeah. Go back. Go back. Go back. Go back.
And keep this because we are going to show that. Okay,
go back.
Alex?
Go back.
Okay.
Go back.
Go back more.
Go back more. Go back. Go back.
So when we left, we were at that stage. We tried different things to try to cross with the delivery sheet. So we first, as you remember, potentially we balloon dilate the track with the it was I think 5 millimeter balloon. And then what we put a long sheet from the right femoral vein to introduce the delivery sheet inside to have more support because we felt that we were losing a lot of support in the right atrium. Despite that, it was not possible to cross the leak. At that point, we decided to go with the AVP2 instead of the AVP3. So we chose the largest AVP2 that can go in 6 French delivery sheet, which is the 12 millimeter AVP2.
Forward.
So next.
So you see, we use a long sheath. Hopefully, it will provide support for us to track the A French delivery catheter, but it just failed. Next. Okay, next.
And this is the 6 French delivery sheet in place. It was easy, to be honest, to put that 6 French sheet in their left ventricle. So next. So at this point, we're moving the dilator and the wire. Next. And we're coming with the device.
Yeah.
Next.
Next.
This is the device, AVP2 12 millimeter large.
Yeah.
The left disc is open now. Next.
因為個 leaflet 唔係好 close 到。
That device is pulled against the leak. Next. I want to remember to you that the AVP2 has 3 components, a left disc, a middle portion, and a right disc.
Blocked here, so there's some.
Okay, so now, next. When we are against the leak, the middle portion and the right portion of the device were open, and this is it. So we have 2 devices in place, and we need to look the echo maybe live.
Yeah.
To see what's the result with 2 devices in place. The 2 devices are still attached. So Alex, what do you think?
Yeah.
Well, I think the 2 devices are
Echo images, please.
put in a reasonable
Echo.
position. The second device is
Wait.
it's okay, but what I'm worrying now is that it seems like one of the leaflets is not closing. Maybe
No,
it's
Alex,
after.
they need to see
We
the
have
echo.
the echo image.
Now,
Yeah.
yes, we have
Okay,
echo
you can
images.
see the image.
for you.
Okay. Now, the device is here. One is here. The one is here, and I think it's closing a leak. And but now what I'm worrying is a little bit is that seems one of the mechanical leaflets is not closing here. Maybe it happens after the put in the second device. So I want to confirm that maybe on the floral is the device blocking the way of one of the leaflets.
Can we see the floral?
Yeah,
see
so
the fluoro?
we can see the fluoro maybe.
Echo floral side by side, please. Oh no, this is not. Yeah.
See, I agree with you, Alex. It seems that the leaflet is knocking on the
On one of the device, yeah.
one of the device.
Yeah.
See, the second device is quite stretched, and you see very well that the mechanical leaflet actually is knocking on the. It seems to the leaflet seems to open and close very well, but there's definitely an interaction between the device and the valve.
And on color 3D, you can see MR through the blocked leaflet, the mechanically blocked leaflet here.
Okay.
Through the valve, huh?
Through the valve, yeah.
So
there's no paravalvular leak now, but there's some leak through the valve
Okay.
here.
So for that
We
reason,
confirm it by another angulation of the fluoro.
Yeah.
I think we can do the RAO 30 if you want, RAO 30, but it was not very clear, the leaflet. I mean, the leaflet, I think they opened quite well. But I'm not sure that it's closing enough. See, this is the RAO 30, the other view. We are parallel. We are looking the valve from the side now. And we cannot see very well the mechanical leaflet, so I think it's less useful, that view, to be honest.
Yeah.
Yeah. So on 2D, there is some valvular leak there.
Because we have at least the echo leak across the valve now. We should probably remove that second device.
Or can we partially recap and try to put it?
Yeah, we can definitely
Heading back
recapture,
and-
partially recapture also, but
and
I think
try to,
it cannot remain as it is.
Yeah, of course. Can we go to, you want to do it in this view?
I think so.
I can see the transfer
呢個 device 喺度擋咗呢
There's
個
a transfer leak.
係啊
Yeah.
開唔到係啊
Okay.
Fine,
So
no.
it's
Fine,
better
no.
now? Yeah.
So the device is still in place. It's partially recaptured. I will redeploy the.
the
Can you see
paravalvular
it?
leak.
Okay.
I mean
Is
not
it still in the
paravalvular,
way?
intravalvular leak. Here, you see the jet here.
Alex, is it still in the way?
Sorry,
Is it still in the way? Because we partially recaptured that
you already
and
partially
we
cap.
deploy it. Is it still in one of the in the
Let
way
me
of the
check.
leaflet?
I think it's better now.
Is there a transfer leak?
Hopefully, it will be
less.
better oriented.
Yes, that's right.
It's now.
I will try to redeploy the device now,
Yeah.
and hopefully, it's going to be better.
Yeah.
I mean, 都係有少少 still a little bit stuck there. See it here.
It's still a little bit. Right?
Can we go back to RL corridor?
Sure.
It's intermittent, you know. Now it's intermittent.
Is it better, Alex?
Intermittent blocking of the closure of the leaflet.
Yeah, we'll have to see it before.
It's better than before.
I don't think that's the case.
See, I still see the mechanical I still see the leaflet of the valve knocking on the device, I think.
Yeah.
The device is very oblique.
There's a comment. Please.
Can I just, don't you think it's because you have a lot of tension on the second device? Try to look at the configuration of your first device, which is outside the ring. Your second device is just perpendicular to the ring, so they may be because you're still attached to the delivery system. So when you release, it may flip around and.
Yeah, I think it's a possibility. The thing is, if you release and if it's not changing the orientation, I mean you remain with that thing. So you're taking a chance to release that device. So I will. But
Happen if this projection, if you push on the delivery system, try to get the right disc closer to the ring.
Sandy, Richard.
I'll see. It's
Very
not
difficult to get proper alignment.
absolutely.
But of course, it's uncertain to know what's happened when you release. But I
Exactly.
would guess there would be a fair chance that it's going to align as the first one.
Yeah, the first one, to be honest, it's perfect. The alignment is cannot be better. This one, I will at this point potentially not leave the device in place like it is. My opinion, but
Can you go back in and LV and then redeploy it again?
see, I'm pulling quite significantly. I try to reorient the device. I will redeploy and see what's happening. It's potentially better now.
Still.
No, we still see some interaction between the valve and the device.
換開，換閂啊！安花實最好啊！
What do you think, guys?
It's not, it's still jamming. This partially
Yeah, it's still
preventing it from closing completely. You see it? Right?
So we probably would attempt to, let's say, partial
Is it
recapture from device and try to go into LV and then
Try to reorientate. I think it will. It's not the AVP3. It's a round device. So even if I'm trying to rotate that device, I think we will end up with the same thing, the same results.
Same results.
Sometimes
The
I'm
size matter?
potentially a bit oversized.
Yeah, maybe.
maybe we can change to a smaller size device and see.
But then it will be foreshortened.
Now we can still recapture that device and try to deploy a smaller device.
Yeah.
But I feel that at the Echo, we are not in the main defect that we want to close.
That's right. I also think that too.
It's strange because on the Echo, we were confident that we are in the right spot with the wire. it seems now that with the device in place,
All packed together.
we're not where we are thinking that we were.
We want a little bit more at 12.
Okay, let's go back RAO. Maybe we can try to recapture, redeploy, and if
Yeah.
it's still the same thing, we should do something else. All right, RAO, please. So long procedure, at least the good news is that we use no contrast so far. Few cc of contrast to inject to localize the delivery sheet, but not more than that.
Okay. So aware that there will be a lunch symposium. So maybe we still
Well,
need
actually,
some
we
time
have one more lecture.
Okay. So how
Hi,
about go
Dr. Stewart.
for the lecture first, and then
I
we
think the
come back
leaflet
for
movement is
updates.
now okay.
Okay, we'll come back to you later. Thank you very much.
Yes. Hello. So what we did just in 10 minutes, we actually tried to reposition the other device. Yeah, we just try to pull. Yeah,
Do we
pull
have the
this
image?
very hard. Yes, just show them the live.
Do we have the image first?
Live photo, please.
Now we see two image view.
Yeah, now you can see the audio images that we repositioned the AVP2, and I think that's the best we can do. Let's go to spider view.
Is it the same one or a smaller size?
Same size, but we just try to deploy the leftist, pull it very hard, so it is actually against the wall. As you can tell from this spider angiogram, okay, so it's quite far away. I do a cine for you. So now the aortic valve is not, the mitral valve is opens freely. Maybe Alex can update to us about the echo finding.
Okay. Now, so I want to show you this very nice image, echo.
Do we have the echo image, please?
Yes.
Yeah. I want to show you this is the final adjustment, and you can see that one of the leaflets here is not closing very well, and that was confirmed on the angiogram. You see here, this is after the final adjustment, and we can see that when the leaflet close, it's both leaflets is closed, completely occluding the. That's very nice closure here. You can see it's after the adjustments of the second device.
Okay.
And there is still a little bit of the mitral regurgitation here, as seen here at the 1 o'clock, but I think the amount has significantly reduced. This is the mitral regurgitation here has significantly reduced, and there's no more intravalvular leak that we saw here. There's no more intravalvular leak, no more mechanical blockage of the leaflet, just as much reduced perivalvular MR here is mild. So look at the 2D, mild MR, significantly reduced mild MR, and the final result is quite good, and this is the final result showing the
Yeah, so
3D
we are going
image.
to deploy the device real time. So maybe we'll show you follow.
Yeah, I guess that we what we need to look for in the next few days in this patient is going to be hemolysis,
Yeah, it will
because
be
of that very
hemolysis.
small residual leak now.
Yeah.
But I'm confident that it's not going to be the case.
Yeah. Okay, let's go to RAO.
Can we have the floral image, please?
Yeah, floral, please.
Sure.
Okay. All right, so we are going to release the AVP3 first.
Can we have the floral image, please?
This-
We are still
Okay, floral
using
images.
the echo.
It's not going, this.
Is this not going?
Oh no, this is the.
Foro images. Foro.
So this is the AVP, the second one. Huh?
Second one.
Yeah. So we are going to, as YY said, we're going to release the AVP3 first. I think it was a very, very stable device. So let's do this first.
Can we have the X-ray image?
Yeah,
We're still
fluoro,
looking at
please.
the echo.
X-ray. Yeah, sorry, the technical staff is looking for that. All right.
Okay, very good.
Okay.
So,
All right.
okay. So AVP3 first.
Okay, so we
that's
released
done.
the AVP3 just now.
Yeah, and then next one
Next will
is going to be.
the AVP2.
So what we did to be sure that we are going to be able to release well the AVP3, we came back with another catheter up to the device in the left atrium.
Yeah.
Because if you try to release from the groin, it can be difficult.
Yeah. Okay.
And now let's deploy the AVP2. Cine. See, very good.
Yeah.
So both devices are in place. We can potentially reevaluate the echo.
Yeah.
Sometimes it shifts a bit, which it was not the case
No
here.
shifting here. Yeah.
Yeah. Can we go to spider view again?
Quite happy with the result that we have. I
Yeah,
think it was a
at least
very,
from-
very, very difficult case. We were able to deliver 2 devices, no valve interference. We are treating her mainly for heart failure. And we have a very, very significant of the amount of leak. So I think it is.
Yeah, I think it's acceptable results. And hopefully there won't be any hemolysis, as you said.
Can you go gastroscopy?
Yeah. Can we show them the furrow as? Yeah, in spider.
Can you cine maybe, or
Yeah.
did you cine of this, and we can
furrow
go
view, please. Yeah.
furrow? Yeah, cine. See, and the valve is functioning very well.
Okay, I'm going to put it back. Okay, so I think that's it. Everybody is hungry. So we have a long day for this case. So everybody sweat a
I
lot.
think we should give a round of applause to all these operators. Have an excellent job.
Yeah.
Thank you.
Thank you.
Thank you, Rita, YY, and Gabriel, and Alex, obviously. So
Yeah.
it's a great job. It's a very difficult case.